and this is a DNP project update. My project's title is Evaluating Kentucky Advanced Practice Registered Nurses' Attitudes and Comfort Levels Regarding Dermatology Care After an Online Educational Module. So a little bit of background on my project. Appointment wait times for a changing skin lesion are about 38.9 days. And early detection of melanoma is very important for a good prognosis. Pediatric wait times are even longer. They can be up to 13 weeks. There's a shortage of dermatologists, 3.6 dermatologists to every 100,000 patients, which could be a big reason why these wait times are so long. And then in this study, they found that 1/3 of the referred patients to dermatology from primary care providers were for benign lesions. This is possibly due to the primary care provider's lack of sufficient confidence in diagnosing benign lesions, so they're just over-referring. Primary care providers do have a difficult time differentiating between benign lesions from melanomas, which could result also in unnecessary excisions and referrals. And then other identified primary care nurse practitioner barriers to adequate skin assessment are definitely due to appointment time constraints. So it's just a little bit of background on why my project, why I chose what I did for my project. So the purpose of this project was to assess primary care providers' comfort level with identifying malignant lesions and performing basic dermatology procedures in the clinic after a short educational module to decrease the unnecessary referrals. That's not necessarily something that this project tested for, but hopefully for future research and a longer time frame, we would start to see those referrals. Not many of the unnecessary ones being made. So some of my specific aims and objectives. So the first objective was to identify a clinical practice issue regarding primary care providers, specifically APRNs, comfort levels, and attitudes towards diagnosing malignant melanoma and performing basic dermatology procedures in clinic. The second objective was to provide education to primary care providers to increase their confidence in their dermatological aspect of care. My overall aim for this project was to examine the changes in nurse practitioners' attitudes, confidence, and comfort levels after a short educational video intervention. So I just threw this in here, like I said earlier. There were more things that I would like to test if I had more time for this project, but hopefully this can be some implications for future research, or maybe some projects that can be piggybacked off this one. I would like to see if the increase in their confidence, primary care providers' confidence levels would alleviate the increased dermatology wait times, hopefully by decreasing the inappropriate referrals. And then also I would hope to see that we can identify those who may be at risk for life-threatening cancer, such as malignant melanoma, and initiate the proper treatment while they're waiting to get in to see that specialist. So my literature review, the PICO question that I used was, among Kentucky APRNs working as primary care providers, how will brief educational resources influence their comfort level with diagnosing lesions and performing basic dermatology procedures in clinic? The two databases that I used were CINAHL and PubMed. The terms used were basic dermatology, which showed 11 articles, dermatology and primary care providers, 44 articles, and dermatology education and primary care providers, which had 8 articles, and dermatology education and primary care, which came up with 28 articles. The inclusion criteria consisted of studies published between 2012 and 2022. The English language and an educational intervention method was utilized. Studies that were excluded were ones that did not focus on evaluation of the educational intervention on primary care providers' comfort levels, attitudes, and knowledge, as well as studies that did not show implementation of an educational intervention. So the overall findings that the literature review found was that educational interventions do increase providers' confidence levels, and there's also not sufficient continuing education for dermatology that's easily accessible to that would help increase their confidence in treating it. The gaps, so again, like I said, currently there's not enough sufficient training available to primary care providers regarding dermatological management and care in primary care clinic. The goal is that all PCP APRNs have access to this education. The gap is that APRNs are not confident in their care due to lack of education. As evidenced by the literature, providing an evidence-based educational video will help APRNs increase their knowledge and confidence with dermatological issues in clinic. This will fill the gap by enhancing PCP's access to an educational resource, thus enhancing their care. So the theoretical conceptual framework used was the Iowa model of evidence-based practice. This model uses methods to aid in implementing evidence-based practice through steps including identification of issues, analyzing the research, and piloting changes in practice. There are 5 steps to this model, which is problem identification, conducting up-to-date literature reviews, create an evidence-based plan and pilot, implement the change in practice, and then disseminate the results. With this model, the educational intervention was formed through extensive literature search, providing up-to-date evidence-based practices. The pre and post surveys were used 2 ways. The pre-survey was used to assess and identify the problem in practice. It determined the APRN's view on their dermatology knowledge, their comfort level, providing basic procedures in clinic, and the ability to detect and diagnose suspicious skin lesions. The post-survey was used to evaluate the educational intervention and determine if comfort levels with dermatology care were impacted. So for my methods, the design used was a quantitative quasi-experimental one-group pre-test, post-test design. And my setting was the Kentucky Association of Nurse Practitioners and Nurse Midwives. Basically to assess the APRN's comfort and knowledge level before and after an educational intervention, a pre and post survey was administered, and that's where we got the design of the study. Surveys were sent out through the KANPNM listserv, and this is just an electronic database of APRNs in Kentucky. The sample size, so the amount of APRNs in Kentucky that were subscribed to this listserv at the time of the project or intervention implementation was 1,244 subscriptions. Of that, once the survey was sent out, 49 responses were recorded and 28 valid responses were what we were able to use. As far as the plan, my plan included a pre-survey of the estimated number of dermatology visits per month APRNs have in clinic, if they are equipped with the appropriate screening tools for malignant melanoma, and their comfort levels performing dermatological procedures. I then provided a brief educational video within the same module about malignant melanoma and the basic procedures that can be performed in the office. And then at the end, a QR code was on the screen and a link was placed so that they could pull up a little infographic of the top most common derm diagnoses that they could see in their clinic. The intervention, so it was a 5-minute video, mainly regarding malignant melanoma. At the end, basic procedures such as punch and shave biopsies and then cryotherapy were also refreshed upon. And then, like I said, the QR code with the 5 most common or very common derm diagnoses was included at the end. And then the post-survey was basically just the same questions that were from the pre-survey to assess their knowledge from, not necessarily knowledge, but their comfort levels after viewing that video. So my data collection and analysis, for the data collection I used UK Qualtrics and SPSS. UK Qualtrics basically was what the whole entire educational module was in. It was a pre-survey, the video embedded in, and then the post-survey. So it was all within the same module. I collected and interpreted demographic pre-survey and post-survey participant answers. The data collection of the survey answers took place once the educational module was closed 2 weeks after the initial project invitation email was sent. The analysis, I used the College of Nursing professor Amanda Wiggins. She was a vital resource in the statistical analysis. We used IBM SPSS to evaluate the data. And the levels of measurement that we have included nominal, ordinal, and interval data. And then the statistical test that was used and could be used was a paired t-test. So, like I said, where I'm at right now, the results are still in a work in progress as well as the discussion. Overall, this conclusion is going to change obviously once we really look at the results and discussion. But from what I could see just at a glance of it, this project did prove what the literature suggests, that educational interventions help increase PCP's confidence in providing dermatology care within their prospective clinics. With these findings, like I said in the beginning of this presentation, further research can be done to arm PCPs with the right tools and knowledge to appropriately treat and triage dermatology cases, thus helping decrease over referral to dermatology that's playing part to the increased wait times. So some of my updates from the spring when we last gave out project updates is that I did gain IRB approval in September of 2022, and I carried out my intervention. And actually, here's some exact dates: October 3rd, 2022 through October 17, 2022. That's when the surveys were open. So now that has been closed, and all of the responses have been recorded, and there's no more data collection happening. I did have a meeting with Professor Wiggins for statistical analysis a week or two ago. I'm just in the process of creating the results section, putting basically what we talked about into words for her to help review. And then a tentative timeline, like I said, I completed the intervention. I'm going to continue to work on my paper. I did just submit the intro, backgrounds, and methods section for the Nursing 910 class. So I'm just waiting for grades and comments back on that. And then I'm not sure of the exact date, but hoping to finish the paper and put together a presentation and have defense sometime next semester before graduation. And then here are my references. Thank you for listening.